Yeah, let's lead in. DVT, swelling related to that, and the condition of DVT and the different treatment modalities.
Well, I mean, let's just talk a little bit about what DVT is. It's most people have heard the term, and it's one of those things that I think creates a sense of fear when people hear about the term DVT, especially when it's related to I've just been on a flight and have I got a DVT? And to be fair, one of the early symptoms of DVT can be swelling in the legs, especially in the ankles and feet. Having said that, if you get swelling in your ankles and feet after a flight, that's also just a normal thing because you've been less mobile and the effects of altitude on the fluid systems in the body.
Yeah. But
one of the side effects can be DVT. But DVT generally is caused by some type of coagulation in the vein, hence deep vein thrombosis in the deeper veins, and that can be precursors to that. Could be injury, it could be trauma, or it can be sort of a progressive vascular deterioration or damage. As an example, conditions like diabetes may be one of the risk factors for developing a DVT.
Yeah.
And that DVT then causes a blockage or a partial blockage of the vein, and that affects how the fluid drains from the limb. And I say ankles and feet because it's much more common in the lower limb. It can happen in the upper limb, but much less commonly. And then what happens is there's less capacity for the fluid to move from the lower limbs, and it starts to accumulate, and you get swelling in the lower limb. The big risk with DVT, obviously, is that if the actual thrombosis separates from the venal wall, then it can become an embolism, and that's usually when people have the more severe emergency episodes such as cardiovascular problems or strokes.
Yeah.
So, I mean, the big thing with DVT is prevention. Obviously, once you get a DVT, there are ways of treating it. You can have specific medications, but if you can prevent that coagulation, prevent that formation of the thrombosis on the venal wall, then you've got a much better chance of not developing a DVT. And ways of doing that, obviously, especially if we're just talking about flying, would be ways of using compression, or intermittent compression is even better because it encourages better venous return, to try and stop, or should I say maintain the flow of the venous fluid, to reduce the risk of it starting, these blockages in the veins, basically. And I think intermittent compression is a great tool to use as a preventative measure to try and stop that. You can also use massage and movement, etc., which can be very effective.
Yeah.
But I think the benefit of intermittent compression is that you can use it regularly and often, and without having to, visit a clinic or a therapist.
Yeah. So just a quick note on intermittent compression. As you can see by the graphics on the screen, we're squeezing from the foot to the thigh. We're moving the excess fluid out. We're keeping, so not only the squeeze is important, but also the release, because we're returning fresh nutrients back to maintain good healthy condition. In regards to DVT, we also developed within our products the ability to take them on an airplane, which you mentioned as being a problem area for DVT sufferers. So
yeah, I think that's a great idea, Michael. Actually, to be honest with you, to be able to have that facility, because again, that's prevention, which is the most important thing, I think.
Yeah. So thanks, Dr. Paul. This has been a quick talk on DVT, swelling related to DVT, the causes and the treatment modalities. Thank you.